Hello, I'm Lashanda Henderson, and I'm going to show you a PowerPoint about a disease called sarcoidosis. I'm going to discuss the symptoms, the cause, the diagnosis, and the effects this disease has on the patient and their family members. This disease is categorized as a lung disease because in most common cases, disease is found in the lungs of the patients. Sarcoidosis is a growth of tiny collections of inflammatory cells in different parts of the body, most common in the lungs, lymph glands, eyes, skin, kidney, spleen, nervous system, heart, muscles, and bones. The cause for this disease is unknown. Researchers are developing probable causes based on sarcoidosis cases. Causes. In some doctor studies, the cause is exposure to bacteria, viruses, dust, or chemicals. They also believe that the disease may have a genetic disposition in developing this disease. It is likely to affect women versus men with the age range of 20 to 40. African Americans are at higher risk of this disease compared to white Americans. Your immune system helps protect your body from foreign substance and anything that might be trying to attack it. A person with sarcoidosis, the immune cells collects a pattern of inflammation called granulomas. When granulomas builds up in an organ or organs, the function of that organ will be affected, causing organ damage. Symptoms of this disease varies based on the affected area. If the disease is located in your eyes, the patient will experience severe redness, sensitivity to light, blurred vision, and severe eye pain. Patients that is with the disease in their skin will experience small to large rashes, lesions, color changes, and adenoids, which are growths just under the skin around previous scars and tattoos. Symptoms in the lungs involve persistent dry cough, shortness of breath, wheezing, and chest pain. In these pictures, you will see the rashes that your skin would develop and skin lesions around your eyes and nose areas. This also shows the lungs, which contains small patches of inflammation cells, the lesions, the small patches of inflammation cells around the eyes. Diagnosis. Sarcoidosis can be diagnosed by your doctor performing several tests, which includes x-rays, CAT scans, MRIs, blood tests, lung function tests, eye exams, and biopsies. Most biopsies are tests that are performed are usually after you have been diagnosed with this disease. And now I want to talk about families. Sarcoidosis entered in my life by my husband in 2003 while deployed to Iraq. Him and his soldiers were conducting a search of a chemical warehouse. The warehouse caught on fire, and my husband seen flames and proceeded to gather his soldiers. They made it out before the chemical warehouse exploded, and I feel that he and the other soldiers breathed the smoke from the chemical warehouse. After years, my husband never showed signs of any type of illness. After being deployed to Iraq for the third time, he began to experience changes in his body. He was losing weight and wasn't trying to lose weight. His eyes was bloodshot red and very painful. He woke up one morning and couldn't see anything. They flew into Baghdad Hospital and later flew into Germany with a diagnosis of sarcoidosis. I see my husband change throughout the years, and it really affects the family, of course, in a different way than the patients. A lot of sleepless nights, several trips to the hospital on a weekly basis, appointments every month or more. My advice to any family member that is dealing with someone with this disease is to be patient with them. It's not an easy disease to have, and to see what my husband go through, I don't think I would be able to survive.